Hi everyone! Today I'm going to be discussing a very interesting muscle syndrome called rhabdomyolysis. First, let's break down the word rhabdomyolysis. The prefix rhabdo means rod or rod-like, referring to the striated muscle tissue. The root, myo, means muscle, and the suffix lysis means breakdown, destruction, or separation. Altogether, rhabdomyolysis is the breakdown of striated muscle tissue. Rhabdomyolysis is when skeletal muscles break down, therefore releasing the contents of the muscle into the body's circulation. Muscles contain a red protein called myoglobin, which holds oxygen within the muscle cells. When there's too much myoglobin in the blood, body functions are negatively affected and the blood cannot be filtered properly, leaving the sufferer with serious damage to the kidneys. The condition is generally rare. Approximately 26,000 people in the U.S. are diagnosed with rhabdomyolysis per year. There are two main reasons for muscle breakdown, which is ATP depletion and direct damage to the muscle tissue. ATP depletion can occur in places such as exercise or while using certain medications. The lack of ATP causes the breakdown of muscle tissue. Direct damage to the muscle tissue breaks the sarcolemma, the sheath which protects the muscle fibers, and therefore releases the contents of the tissue into the bloodstream. These contents include potassium, phosphates, lactic acid, purines, and as previously mentioned, myoglobin. The kidney is not able to process these contents quickly enough, which causes damage. There are many causes of rhabdomyolysis, so here I've listed only some. Rhabdomyolysis can be caused by drugs and toxins such as cocaine, alcohol, heroin, fibrates, and statins. Genetic disorders where it's difficult for the body to metabolize lipids or purines, or glycolysis disorders, and metabolic disorders such as hypocalcemia, hyperphosphatemia, and electrolyte imbalances can all cause rhabdomyolysis. Other causes can be infections and inflammation from injury, such as viral and bacterial infections and snake bites or venom. Trauma and exertion of the muscles can cause rhabdomyolysis, with crush injuries being the most frequent cause of the syndrome. Seizures, strenuous exercise, lightning strikes, electrical shocks, and burns can also cause trauma to the muscles. Hyperthermia and hypothermia, when the body becomes too hot or cold, are also causes. Lastly, rhabdomyolysis can be seen in those with limited movement, such as patients who are in a coma or who are recovering from surgery. Rhabdomyolysis is often seen in athletes who must engage in strenuous exercise. Sometimes individuals, such as marathon runners or service member recruits, will participate in strenuous exercise even though they are not exactly equipped to do so. These individuals are in danger of developing rhabdomyolysis due to overworking their muscles. The sudden depletion of ATP causes the muscle to break down. Exercising can also lead to heat exhaustion and dehydration, which can lead to heat strokes and therefore rhabdomyolysis. Because of this, rhabdomyolysis is seen in many active jobs, such as athletes, firefighters, and service members. Elderly patients can also develop it after periods of being sedentary or due to trauma, such as having a bad fall. Patients are determined to have rhabdomyolysis if they have the triad of symptoms, which are dark urine, often referred to as Coca-Cola urine due to its dark brown reddish color, muscle weakness, and muscle pain. Interestingly, less than 10% of cases possess all three of these symptoms. Other common symptoms include general malaise, fever, nausea, vomiting, abdominal pain, decrease in urination, tachycardia, confusion, and an irritable mood. Rhabdomyolysis can lead to many complications, with the most serious being acute kidney injury. Hyperkalemia, hypocalcemia, and hyperphosphatemia can all occur. Compartment syndrome, pressure buildup from the swelling of tissues and/or internal bleeding, can be a serious consequence of rhabdomyolysis. Another serious complication is hypovolemia, which is when the amount of plasma in the blood is too low. Both of these conditions can result in organs or tissues not receiving enough blood or oxygen, which is life-threatening. In approximately 25% of cases, rhabdomyolysis leads to liver damage. Tests for rhabdomyolysis are administered via blood sample or urine sample. These include tests such as measuring the creatine kinase levels through both blood and urine, testing myoglobin level in the blood, and performing a urinalysis test. If a physician wants to pinpoint the cause of the rhabdomyolysis, they can order a CT scan or an MRI scan, or perform a muscle biopsy. IV fluids are always given to patients as treatment. In more serious cases, a blood transfusion or dialysis may be required if the kidneys are badly damaged. A fasciotomy may be required if the patient has compartment syndrome. Patients can self-treat by drinking lots of liquids and staying away from alcohol. Preventative measures can be to avoid overexertion during exercises, making sure body temperature is regulated by not being too hot or too cold, avoiding dehydration, staying away from certain drugs, medications, and toxins, and using proper safety equipment or care while engaging in dangerous activities. Thanks so much for watching. I hope you learned something interesting about rhabdomyolysis today.